Have you been told by your bariatric surgery clinic, no caffeine for a month after surgery? And yet you have a t-shirt in your dresser that says, but first coffee. Hey, I'm Steph Wagner. I'm a dietitian and I support patients in the everyday life after weight loss surgery at bariatricfoodcoach.com. So what's going on here with caffeine? You know, some programs will say no coffee or tea for a month, and some will say 2 weeks. Others won't restrict it at all. One thing to note is that there is kind of a governing body over bariatric surgery clinics called the ASMBS, the American Society of Metabolic and Bariatric Surgery. So if you had your surgery at a center of excellence, which is a great thing to do, that means that they have been accredited and passed the test from the ASMBS. A lot of time and attention is going to be spent in the operating room, which I'm glad that that's where they spend most of their time and focus. So there's going to be a lot of standards and procedures and protocols, best practices that are going to be especially focused on the surgery itself and the healing process. But where we start to see a little bit of nuance is in things like the food. Some programs will have a ton of different stages of the diet progression, and others will have this more conservative approach to when you can have caffeine. The deal with caffeine is that the concern is it could cause an ulcer. More commonly, what we see causing an ulcer would be NSAIDs, which would be like your ibuprofen. So NSAIDs will never be recommended again after surgery, but caffeine tends to come back in, again, depending on your program. Most all programs will allow decaf coffee, so that's good news, even if it's like, hey, wait a minute, that is not the same. At least you get the experience of having a warm cup of coffee if that's your morning routine. The thing to watch is your coffee mate. I once had a patient that was doing awesome, eating great food and food journaling and exercising, and we weren't seeing the progress that we thought she should be making. So I asked her about her decaf coffee. She's like, you know, I really drink a lot of decaf coffee through the day. And I said, well, what do you put in your coffee? And, oh, it's my cinnamon creamer. I said, okay, how many days does it take to go through a bottle of cinnamon creamer? About 3 days. That was it. Once we kind of backed off on the creamer, she did start to see serious progress. So you do have to keep an eye on that coffee mate. You might need to get the tablespoon out and measure your 2 tablespoons or whatever the serving size is. And if you're someone that likes a high ratio of creamer to coffee, you might have to drink less decaf coffee so that you still get the ratio, but you're not overdoing it on the coffee mate. So caffeine will come back in. And the next question is, well, how much do you get when it comes back? And that will change also, so check with your program. But what I've always said is aim for 64 to 96 ounces of hydrating fluids, your water, flavored waters, broths, herbal teas, to make sure we're keeping you hydrated. And then you can have coffee or caffeinated tea, but you wouldn't count it towards water. And I would say not more than maybe 20 or 24 ounces a day. More than that, and it does get hard to get all of your water in, especially when you can't drink with your meal and for 30 to 60 minutes after your meal. Water is always going to be the highest priority. Now that's actually kind of a controversy. Some will say that caffeine in coffee is not a problem and that coffee is hydrating. You'll see a lot of research that says coffee is hydrating. Again, that might change depending on your program, so you can check with them. Typically what we say is that after bariatric surgery, you are a high risk for dehydration. Caffeine has a little bit of a diuretic effect. Diuretic means you have to go TT more often. So you might be losing fluid in your body if you have more of a diuretic. But again, programs differ on that. If you're noticing headaches or jittery feelings, definitely time to ease up on the caffeine. Typically, I just say enjoy your coffee, but keep going on your water. A few other things to note about it. One thing, you don't want to have your vitamins with tea or coffee because of the tannins, especially tea. Tea has a lot of tannins, tannic acid, and that can inhibit the absorption of iron. It's pretty common that we see avid tea drinkers have problems with their iron levels. So watch your tea consumption if you have a history of low iron. And when you take your iron-containing vitamin, don't drink tea for maybe 2 hours before or after. One last comment on this conversation is caffeinated soda. So if you're wondering if you can have Diet Coke, Diet Dr. Pepper again, that's also going to depend on your program. Carbonation typically is going to have a much bigger window of waiting compared to caffeine. So we're probably going to wait at least 6 months, maybe longer, before trying carbonation. And that's actually eased up. It used to be no carbonation ever after surgery, but now the recommendation is to open it up, let the fizz go, sip on it, and see how it goes for you. Things to watch for might be belching, bloating, gas, pains, or if you're feeling too full to eat quality protein at your mealtime and you're not getting adequate nutrition. So it's possible you could have caffeinated, carbonated diet soda again farther down the road when you're staying hydrated. The other thing to watch is that a lot of times we see snacking alongside diet sodas. So if you typically have crackers or chips with your diet soda, then you may want to watch that it doesn't reintroduce old habits. And finally, the transition off of caffeine can be really rough. So my other tip for pre-op patients that are going to be going through this process of having no caffeine and you are a daily coffee caffeinated drink person, I would wean down before surgery because healing from surgery is no small thing and going through caffeine withdrawals is not fun. I personally don't want to do all of that at the same time. Maybe you'd like to rip it off like a Band-Aid and enjoy your coffee up until they say no more. I think it's easier to wean down your coffee and manage the withdrawals before you go through the surgery healing phase itself. So to wrap it up, follow your program's guidelines. Don't take NSAIDs like ibuprofen. Enjoy some decaf coffee if you watch your creamer consumption. And follow me at Bariatric Food Coach for more recipes, tips, and resources.